to everyone. I'm Paulina Barrientos from Santiago de Chile. So today, with one of my residents of the postgraduate program in prosthodontics, Constanza, we are almost about to install and deliver a complete denture prosthesis. So Constanza, tell me, how long does it take to you to fabricate this complete denture?
It took me 6 weeks.
Oh, so a lot of work, right? And tell me, did you consider by any chance to fabricate this complete denture with a digital workflow?
Yes, but I have 2 concerns. One, about the pressure of the soft tissues for the functional impressions, and 2, the stability of the resin printing material.
Okay, I see. So there is a very interesting article published by you in the last issue of the International Journal of Prosthodontics, where they compare the conventional or traditional way to fabricate a complete denture versus a digital workflow. So let's see the article.
Primary exploration of the clinical application of 3D printed complete dentures. So the purpose of this article is to explore the application of 3D scanning and printing techniques in the restoration of dentalus patients with complete dentures. They have 30 patients divided in 2 groups, Group A and Group B. Group A got traditional complete dentures and Group B got 3D printed complete dentures just in 2 visits in a week. You can see here some images and pictures of the digital workflow. So they measure patient satisfaction using the visual analog scale at 4 times, immediately after delivery and then after 1, 3, and 6 months. Measuring parameters as aesthetics, ability to speak, ability to chew, stability, and comfort. So the results showed that aesthetic and stability were pretty good since the beginning in both groups. However, speaking, chewing, and comfort improved significantly after a month at both groups as well. So some important points of the discussions are: intraoral final digital impression is not accurate in terms of soft tissue compression. Bite registration still has to be in an analog way. And the 3D printing material do not have ideal properties in terms of color stability and strength. So the base score was not significantly different between the 2 groups at any time point. The ability to speak, to chew, and the comfort of the 2 groups scored low immediately after denture delivery, but then they improved significantly after a month. So this improvement could be due to exercise and adaptation. Therefore, dentures reached a stable status after 3 months. So the conclusion is that the 3D printing of complete dentures can rapidly restore edentulosity to meet the patient's demands regarding aesthetics and function. This treatment has a huge potential and further studies are needed. So I would like to invite you to review this last issue of the IJP, and I hope you are having a great and wonderful new year. Bye!